Guys, welcome back to the channel. So we have started with necrotizing fasciitis and we have almost completed it. Just the treatment part and prognosis part is left. Okay, so starting that today. Okay, we have seen that reconstructive surgery, we have to see what are the antibiotics. So it is treated aggressively with aqueous penicillin 2 million unit IV every 4 hours and clindamycin 600 mg IV every 8 hours. So penicillin every 4 hours and clindamycin every 8 hours. Penicillin, the unit will be 2 million and the clindamycin will be given in the dose of 600 mg. Metronidazole 500 mg IV every 8 hours used as an alternative to clindamycin. If clindamycin is not given, then metronidazole 500 mg IV 8 hours is given. An initial debridement is very necessary. So an initial debridement followed by hyperbaric oxygen at 2.4 atmospheric pressure, 90-minute exposure twice daily. So hyperbaric oxygen at 2.4 ATA 90 minutes twice daily. Penicillin allergic patient, erythromycin 1 gram IV every 6 hours is given. So if patient is allergic to penicillin, then the drug of choice will be erythromycin. Now coming to prognosis, mortality and morbidity can be reduced by early and aggressive treatment. Resultant would undergo skin grafting after a granulation tissue base develops. Smaller areas can be left to epithelialize secondarily, and larger wounds may require either a myocutaneous flap or a free vascular flap. So grafting and flap procedure after reconstruction or reconstruction are done with that. So better to be called like that. So that's all about necrotizing fasciitis. We'll be starting the next topic also today, that is cavernous sinus thrombosis. Okay. Now, cavernous sinus thrombosis is a life-threatening infection whereby an infected thrombus in the location produces a subset of dramatic symptoms. So it is a life-threatening condition, mostly caused by staphylococcal organism, but streptococcal and mixed flora which are found in oral cavity are also involved. Although cavernous sinus thrombosis may develop or may evolve from sinusitis, facial skin infection, scalp infection, otitis externa and interna, as well as any complication of head and neck surgery, the odontogenic sores are the most familiar to oral and maxillofacial surgeon. So the odontogenic sources are most familiar in cavernous sinus thrombosis. Though it evolved from all of this, but our main concern, we are most familiar with the odontogenic sources, that are canine space abscess and other maxillary dental infections. Okay. Now, the infection site produces a progressive clotting of the inferior and superior ophthalmic vein, which drain into the cavernous sinus, thus creating the infected thrombus in this paired venous sinus that surround the sphenoid sinus and sella turcica at the base of the skull. Now what happened, this is a kind of anatomy, okay, of cavernous sinus. Now staphylococcal organism which produces coagulase are the usual cause of thrombus. Once the infection begins, it will produce a subtle edema at first and progressively causes dysfunction of cranial nerves 3, 4, 5 and 6, and more significant edema with a host of intraocular and extraocular manifestation. Okay, so which cranial nerves are involved? 3, 4, 5 and 6 are involved, or dysfunction of this cranial nerve happens in cavernous sinus thrombosis. Okay, that's all for today. We'll be continuing cavernous sinus thrombosis in next class. Till then, like, share, subscribe and comment. Bye.